Shoulder range of motion, shoulder abduction. Have your partner lie supine with his arm in neutral position by their trunk. The axis of rotation is the anterior aspect of the acromion. The stationary arm is aligned with the thorax, and the mobile arm is the midline of the humerus. Normal range of motion is 180 degrees. Brody obtained 170 degrees. Hip range of motion, hip flexion. Have your partner lay supine on the mat table with his lower extremities in a neutral position without any internal or external rotation or abduction. Axis of rotation is the greater trochanter. Stationary arm is aligned with the midline of the pelvis, and the mobile arm is aligned with the lateral epicondyle of the femur. Normal range of motion is 120 degrees. Brody obtained 102 degrees. Spine range of motion, cervical extension. Have your partner sit with his head in a neutral position. The axis of rotation is the external acoustic meatus. The stationary arm is perpendicular to the ground, and the mobile arm is aligned with the bottom of the nose. Normal range of motion is 60 degrees. Brody obtained 56 degrees. Shoulder manual muscle testing, subscapularis. Have your partner lay prone with their head facing the testing arm. Have a towel roll under the proximal humerus and glenohumeral joint supporting his anterior shoulder. Stand on the side being tested. Place partner's arm in 90 degrees of shoulder abduction with the elbow at 90 degrees. Instruct your partner to laterally rotate his shoulder joint, lifting his palm to the mat table. Use one hand to support the partner's elbow and resist at the wrist. Ankle-foot manual muscle testing, tibialis anterior. Have your partner sit with their lower leg off the edge of the mat table. Sit on a chair or stool and place their foot on your thigh. Assess range of motion by addressing your partner to move their foot up and in. Place one hand behind the ankle and the other hand on the medial border of the foot. Resist into plantar flexion and eversion. Spine manual muscle testing, quadratus lumborum. Have your partner lay supine holding the sides of the mat table. Grasp one leg just proximal to the ankle joint and have your partner hike his pelvis to his ribs. Pull down on his leg.